Is your back pain really just a sore muscle? Or is it a disc injury slowly getting worse? Here's the problem. Most people, they'll stretch their back. They'll foam roller it and just wait and see what happens. But when a disc injury is involved, like a disc bulge or herniation, those fixes don't just fail. They can actually keep you stuck in pain for a very long time. In the next few minutes, I'm going to show you how to tell the difference using 5 specific warning signs most people completely miss. Make sure you catch all 5 because most people won't have all of them, and if you miss even just one, you could end up treating the wrong problem and dragging this out much longer than it needs to be. Hi, I am Dr. Chris Cameron, a chiropractor right here in Lucan, Ontario. For the last 25 years, I've had the privilege of helping people with conditions like back pain, neck pain, disc bulges, disc herniations, and sciatica. We get them back to doing the things that they love and enjoy using safe, non-surgical methods that don't rely on medication. On this channel, I share practical strategies to help you manage pain, heal disc injuries, and try to build a stronger, healthier spine. Make sure you subscribe so you don't miss any of our weekly videos. Before we get into the 5 signs, this video is not meant to diagnose anything. This is for education purposes only. If you notice these signs, you should get a proper evaluation. Sign number 1, pain that travels down your leg. Let me ask you something. Have you had pain that stays in your lower back, or has it started moving into your leg? That's one of the biggest indicators it may be a disc problem. When a disc bulges, it can press on a nerve, and that nerve travels down the back of your leg, through the buttocks, into the feet sometimes. So pain that doesn't stay local to the back, it follows a nerve path, it's sharp, it's burning, it's electric, that's not a tight muscle. If your pain is spreading, that's a very strong indicator, a signal this is a disc issue. Number 2, numbness and tingling. Have you noticed pins or needles, numbness, a buzzing feeling in your leg or foot? Muscle problems do not cause that kind of issue. This only happens when the nerve signal gets disrupted. Instead of clear communication, you get distortion, and that follows a very specific path in the leg. If your pain includes numbness or tingling, this is no longer a muscle or back issue. Number 3, muscle weakness. Now let's move beyond just feeling and into function. Have you noticed your legs feeling weaker or less stable? When a nerve stays compressed for a long time, it doesn't just affect the sensation, it affects the strength. You may notice trouble lifting your foot, difficulty on stairs, feeling unstable when walking. In more advanced cases, this can lead to something called foot drop. This is not a strength problem, it's a signal problem. Sign number 4. Pain is worse with sitting or bending. Do you notice that your pain gets worse when you sit or bend forward? That's not random. Those positions increase pressure on the disc. A healthy disc can handle that. An irritated disc cannot. One of the biggest misconceptions, people think sitting helps a disc problem. But with a disc issue, it often makes things worse. If your pain flares up with sitting, that's a major clue. Sign number 5, pain with coughing or sneezing. This one, it surprises a lot of people. Have you ever felt a sharp pain, a jolt, when you cough, sneeze, or laugh? That's a pressure issue. Those actions increase the pressure inside your spine and inside your disc, and if the disc is already irritated, that pressure spike triggers pain, and it's usually in a very predictable fashion. If that's happening, it's a strong indicator of a disc issue. When we look at all 5 of these signs, pain that travels, changes in sensation, muscle weakness, sensitivity to position, pressure-related flare-ups, that's a pattern and it points strongly to a disc issue. If you've noticed any of these signs, drop a comment down below and let me know which ones apply to you. And if this video was helpful to you, go ahead and like it and share it with someone who's dealing with lower back and leg pain. So what do you do next? Disc problems are not fixed with one stretch or one exercise. They require a multimodal approach. That means addressing movement, support, disc pressure, muscle coordination. In our clinic, we use an 8-step program called the Back Strong Protocol. And in 2025, 78% of our patients saw at least a 50% improvement within the first 3 months. If you would like to understand more about how it works, go ahead and watch the video up here.